Good afternoon, ladies and gentlemen. May we request everyone to be seated as the program will start shortly. This afternoon's program will be webcast through the internet and beamed live to UP Mindanao, UP Manila, UP Los Baños, UP Visayas in Iloilo, Cebu, and Tacloban, UP Baguio, and UP Open University. At this point, we would like to acknowledge the presence of UP President Emerlinda R. Roman, other UP system officials of UP Diliman, represented by Chancellor Sergio Cao, and the officials of the various constituent universities. UP Open University is represented by Chancellor Grace Javier Alfonso. UP Manila is represented by Chancellor Ramon Arcadio. We also welcome our faculty, alumni, students, reps, staff, and other guests here in UP Diliman, NISMED, and in other campuses. Good afternoon once again, ladies and gentlemen, and welcome to the Forum on Universal Health Care. Please rise for the Philippine National Anthem.
Sayang magiliw, pero sa silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyat ka ng magiting, sa manluluki, kita pasisigil, sa dagat at bundok, sa simoy at sa langit mong pagkaw, ay nilang ang tula at awit sa paglayang minamahal. Ang kisap ng watawat mo'y tagumpay na nagtitigil, ang bituin at araw niya kailan pa may magdidilim. Lupa ng araw ng aming pagsikta, ay hayangin sa dilim ko. Aming ligaya na pag may mga akit, ang namatay ng dahil sa'yo.
You may now take your seats. To set the tone for this afternoon's program, may I call on the President of the University of the Philippines for her message. Ladies and gentlemen, welcome Dr. Emerlinda Roman.
Good afternoon, ladies and gentlemen, and I'd like to give our special welcome to Chairman Bayani Fernando and to Dr. Esperanza Cabral, who is the Secretary of Social Welfare and Development, Social Work, Welfare and Development. Last summer, with the UP Centennial celebrations behind us, we held a UP system-wide conference to determine the directions that UP would be taking in its second century. We accepted the institutional responsibility that comes with our becoming the national university as specified in our new charter. We recognize that the nation looks to UP for more than academic excellence. The country expects the university to produce scholars who are both aware of and concerned about the socio-political and economic problems affecting our society. And we resolved that to deserve the honor of being the national university, UP must seriously reconcile its academic goals and intellectual pursuits with society's urgent concerns. Another imperative, as suggested by Professor Randy David in the conference's keynote lecture, is the recognition that our leadership role includes the need to raise the level of discourse about important ideas and pressing issues. For in this too, society has the right to expect guidance and direction from its premier institution of higher learning. Today, we gather here as proof that this is responsibility we take seriously indeed. We are here to discuss one of the urgent issues of our times, health care, and the need to design and implement a more comprehensive and efficient health care system. For decades, studies have indicated that the deficiencies and insufficiencies in our healthcare system are growing at an alarming rate. Basic health status indicators, such as life expectancy at birth, infant and child mortality rate, maternity mortality ratio, reveal an increasingly widening gap between the health conditions of poor communities and those of affluent communities. All add up to a healthcare system that has become a multi-billion peso commercial enterprise. Essential services and goods have such high price tags that they seem to be no longer a necessity but an extravagant luxury. There has been no lack of attempts to institute reforms in our healthcare system. The most recent is, of course, the Cheaper Medicines Act of 2008, which the Supreme Court recently lauded for its, and I quote, sensible and compassionate approach with respect to the importation of pharmaceutical drugs urgently necessary for the people's constitutionally recognized right to health. To reinforce the Cheaper Medicines Act, Executive Order number 821 was issued in July, reducing by half the prices of essential medicines for hypertension, diabetes, cancer, bacterial infections, and amoebiasis. There is no doubt that these developments are both necessary and important in the effort to achieve a healthcare system that is responsive, effective, and fair. But healthcare is too important an issue to be approached in a piecemeal fashion. There is need for a comprehensive plan that will cover both immediate and long-term needs. We also need a viable plan that will accommodate the intertwined yet diverse interests of the health industry's stakeholders, government officials, healthcare practitioners, medical services and goods providers, consumers, and even mass media. To confront the problem of inequity and inefficiency in the country's health services, a group of UP professors and experts have undertaken to take a close, hard look at our healthcare system, to define the problem areas, and to formulate possible remedies. We thank former UP Manila Chancellor and UP University Professor Emeritus Dr. Ernesto Domingo, as well as former Health Secretary and UP College of Medicine Dean Dr. Alberto Romualdez, and the members of the group as well, for not only accepting this challenge, but also for agreeing to lead the research and direct the study for a proposed comprehensive action plan that will hopefully lead to measured, responsive changes. And we thank everyone who has made the time to join us here today to contribute to what we trust will be a most fruitful exchange. The group led by Drs. Domingo and Romualdez has identified building blocks as basis for instituting holistic reforms in our healthcare system. We will hear from our experts shortly on how each of these building blocks can be developed into an accessible, affordable, and effective healthcare system. Concrete steps toward comprehensive reforms in our healthcare system have been a long time coming. It is only fitting that one of the National University's first initiatives, as it stands at the threshold of its second century, is this Blueprint for Universal Healthcare 2010-2015 and beyond. Thank you and good afternoon.